Welcome back. The time is 6:42. February is National Heart Health Month. According to the CDC, heart disease is the leading cause of death for both men and women here in the United States. I found out about the most common type of heart disease at Southeast Alabama Medical Center. It's a broad term, heart disease.
Valvular heart disease, problems with the heart muscle itself, electrical problems, arrhythmias.
But the most common type is coronary artery disease.
Or atherosclerosis is very high in this area. We're sort of in the stroke belt, which is an area across the country where you have a very high incidence of strokes and heart disease.
This occurs when plaque builds up in the heart's arteries. Dr. Alabuddy says there are usually no symptoms to plaque buildup, but warns it does not take much plaque to cause problems.
You can see plaque buildup in the arteries of the heart as young as 18, 19, 20. You know, you could jog and run and work out and feel fine, but sometimes these plaques become unstable and they rupture open. And then when that happens, the contents of the plaque get exposed to blood, and then a blood clot develops right where the plaque ruptures, and then you go from being okay to having no blood flow, and that's a heart attack.
Symptoms of a heart attack go beyond chest pain. Dr. Alabuddy says it can be anywhere from your earlobes down to your belly button, but knowing the symptoms is what's important.
I mean, it may be in the back, or up in the shoulder area, or maybe just down the arm or in the wrist. A lot of patients that have gone to the ER with a toothache, thinking that it's a toothache and it's really a heart attack.
The location of this angina, or heart pain, is also different in women when compared to men.
In men, it's usually exertional. In women, it's usually maybe more after stressful events, at night, at rest.
A stressful event caused Tanya Money to have a heart attack. She has worked in the medical field for over 20 years, so she recognized the symptoms right away, which saved her life.
No doubt in my mind what it was. It was immediate, severe pain in the middle of my chest, and then a few seconds later I had the radiation down my arm. My advice would be to know what risk factors you have for heart disease.
Risk factors for heart disease are diabetes, high blood pressure, smoking, which includes smokeless tobacco, high cholesterol, and family history. If you're experiencing any heart attack symptoms, Dr. Alabuddy says take an aspirin and go to the ER right away. There's a 2-hour window to save a majority of heart muscle. Beyond 12, it's too late.